everyone, my name is Kisa Morlatomba, your student nurse from Davao Doctors College. And today I am going to perform the basic life support for adult, children, infant, and newborn return demonstration. So basic life support is the emergency management provider be the first responders, healthcare providers and the safety personnel to people who are experiencing cardiac arrest in the respiratory distress. So now I am going to perform the adult cardiopulmonary resuscitations and AED skills. The first, I am going to begin with the assessment and activation. So as I arrive at the scene, I see the patient unconscious. So the first that I will do is to scan at the area of the environment for any hazard present that can potentially harm us. So now the scene is safety. We have to wear the personal protective equipment such as the gloves. So after ensuring the scene is safety, I am going to check the level of consciousness of the victims by asking if he is okay. Sir, are you okay? Sir, are you okay? Sir, are you okay? So while I'm doing that, I also assessing whether the patient's breathing. So as I can see that the victim is not responding, it is not breathing, I am going to activate the emergency response system. So sir, in the black shirt, please call 911 immediately. We have the patients here and need immediate help. So after doing that, I am going to check again the breathing and the pulse of the victims, and we also need to check the mouth as well to if there is any causes of obstruction of the airways. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. So determining that my patient has no pulse and is not breathing and unconscious. So now I am going to perform the CPR. CPR is the life-saving skills of the combines chest compression with the artificial ventilation to maintain the brain function. So that restores spontaneous blood circulations and breathing to the patients who has gone into the cardiac arrest. So now first locate the chest area of the patients and hand placement on the lower half of the sternum. Then start doing the 30 chest compressions or deep of 2 inches. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So now ensure that there is a complete chest recoil for each compression. So after doing the chest compression, immediately give 2 rescue breaths to the patients. I am going to use the bag mask or barrier device and cover my patient's mouth and nose. Cover my patient's mouth and nose with it and hold the tilt and chin at the deliver the rescue breath. So each rescue breath should be given over the seconds and there should be a visible chest rise for each breath. So now after doing that, we'll have to resume or continue doing the chest compressions and rescue breath until AED arrives or emergency responders to take over. So now I'm going to perform the AED skills, and let's assume that AED arrives, and so assuming that I am the second responders. So now I am going to turn on the AED. So AED is also known as the automated external defibrillator. Is analyze the heart rhythm and if necessary administer an electric shock to help the heart to re-establish an effective rhythm. So now I am going to place the patches. So 1, well, over at the upper right areas of the chest, and below the clavicle, and the other one will be placed beneath the armpit, just below the nipple line. So AED is still analyzing. After a while, I will tell us to stay away from the patients and do not touch the patients because it will deliver an electric shock. And while that happens, um, what we are going to what we're going to do is to clear delivery shot in 3, 2, 1, shot delivered. So after doing that, the AED will fill us to resume the 30 chest compressions and rescue breath for the how many cycles, and after that we'll reanalyze again to the patient's heart rhythm, and if necessary still it will deliver an electric shock. So we will continue until the AED tell us to stop, or until the patient has already been revived. So after everything, doing all the procedures, we'll have to document the procedures done, the time and the resuscitations started up, and the until the time ended, and switches rules every 2 minutes of after every 5 cycles.